How is chronic graft versus host disease different than acute graft versus host disease?
Chronic and acute GVHD are, separated temporally, of course, because we expect that the acute happens early. But acute is better understood in terms of the pathophysiology, and it is, I always tell patients, I give you a list of things to look for, but even if I didn't, you're going to call me when these things happen because they happen so quickly and they turn severe. With chronic graft versus host disease, it's a much more insidious onset type of disease. And instead of me being able to list exactly what can happen, chronic graft versus host disease can look like almost anything. So patients come in and they're being seen less frequently because it's further out from transplant. They may be experiencing symptoms that they don't even think of as pertinent enough to make a phone call. So I usually tell people, this is a period where I might be seeing someone every 6 or 8 weeks. They look great, they're feeling fine. I say, call me if anything changes, and I see them 2 months later and they're 15 pounds lighter than they were before. And yeah, maybe their stools are a little bit looser, but nothing that they were really concerned about. And that could translate to somebody actually having small bowel graft versus host disease where their absorption is altered. So the list of the organs that are targeted is very long. It can look like many different things. And it does require sort of a level of continued vigilance, monitoring with people who are aware of what it can look like in order to diagnose.